It's pretty well understood how important the health of mothers and caregivers in general is to the health of their children. A positive bond between children and their primary caregivers is one of the strongest protective factors we can foster. Yet, for some women, maternal depression can hinder the development of this bond. Maternal depression is defined as the spectrum of depressive symptoms occurring in a mother during pregnancy and within the first year after childbirth. In general, as many as 12% of all pregnant or postpartum women experience depression in a given year, and for low-income women, the prevalence is doubled. If you work in family practice, you're likely accustomed to managing maternal depression. But pediatricians sometimes feel like looking at a mother's health is out of our swim lane. True, we don't diagnose and treat maternal depression on our own, but oftentimes pediatric providers are the only ones seeing mom after the first 6 weeks postpartum. We can and should screen for potential concerns, and when appropriate, connect mothers with help. It's part of our role in pediatrics because there is a significant body of research connecting maternal depression to a child's well-being. Maternal depression can impair the serve and return interaction or mutual responsiveness between the mother and child, which is incredibly important for child development. Short and long-term effects for the child can include reduced attachment and bonding, impaired social interaction, and cognitive, language, and social emotional delays. For some mothers, discussing maternal depression is difficult. A mother may struggle with a sense of stigma or fear that acknowledging her feelings of depression somehow means she doesn't love her child enough. Maternal depression is not the same for everyone. Some women experience few symptoms and others experience many. The type, duration, and intensity of symptoms varies. For example, some mothers primarily experience symptoms of anxiety. This is why it's important to utilize a validated screening tool to identify mothers at risk for maternal depression. Nuances in its presentation can be missed when relying solely on clinical judgment or when using a tool that has not been validated. A validated screening tool is one that has been measured for reliability, consistent results, validity, accurate results for the target problem and population, and sensitivity, probability of accurate identification of a patient with a condition. Using a validated tool is an important part of being able to bill for maternal depression screenings.
It's hard for a mom to even know that she is depressed, much less for anyone else to know, like, this mom is experiencing maternal depression. There's no one type of mother that maternal depression can affect.
This is something that is a very sensitive topic, and a lot of moms feel uncomfortable talking about it. But what we found is they're very thankful that we care about them and their health.
And so the pediatrician can do a lot just in sort of demystifying the process and making sure that the mom doesn't feel judged for having those symptoms.
To say it's something that's very common, but if we talk about maternal depression and talk about helping you and your child now, there are a lot of consequences or repercussions that we can avoid. Talking about how important it is for a child to bond and attach with their caregiver reinforces, then when you turn around and do a maternal depression screen, they kind of understand why you're asking.
He always asks how I'm doing at every appointment, make sure I'm getting enough sleep, if I need any help with anything, if there's any way that he can reach out to help, especially when my children have been so sick, making sure that I'm taking care of myself and not just my child, because your child needs a healthy parent also.
The American Academy of Pediatrics recommends maternal depression screening at 1, 2, 4, and 6 months. Many practices use the same screening process for fathers and others who serve as a child's primary caregiver, as depression can impact them as well.